My name is Nicole Voermans. I'm an adult neurologist at the Radboud UMC in Nijmegen, the Netherlands, and I'm part of the neuromuscular team working for congenital myopathies. I'm working on congenital myopathies, which are a group of inherited muscle diseases caused by defects in proteins which work in muscle cells. And congenital myopathies often present in childhood, after birth or later in childhood. There's muscle weakness, children cannot develop motor milestones as rapidly as others, and always are performing less than children of the same age. And many of these congenital myopathies are rather stable in adulthood or only mildly progressive. And due to that, many patients with a congenital myopathy have a normal lifespan and grow into adulthood with their disease. And in my center, we work on trial readiness for these congenital myopathies. That means that we try to define what the natural course of the disease is, so how the disease progresses during life without a specific drug, and also what are the best measures to assess the natural course. So what tests should you do to know how the disease is progressing? And beyond that, we also look at the best optimal management so far. So what are the best rehabilitation techniques which are available? And this contributes to the fact that patients are treated in the best way possible at the moment, but also prepare patients for future trials. For many of the congenital myopathies, preclinical researchers have worked on therapies addressing the underlying mechanism of the disease. A nice example is the drug treatments being developed for X-linked myotubular myopathy, which is one of the congenital myopathies. And there were two big international trials, so drug tests, over the past few years. Unfortunately, they had to stop because of side effects, but nevertheless, we learned a lot about these diseases and also about possible side effects of these treatments. And this knowledge will be used in future trials. And as such, the trials in centronuclear myopathies have been an example for other congenital myopathies, which are also very rare and for which trials will be started in the next few years. What we did in my center is that we talked to patients who were a trial participant or parents of trial participants of these trials in centronuclear myopathies to learn about their experiences, because we think that experience of patients in these first two trials are crucial for future trial design. So patients tell us what it was like to be a trial participant, so we can use their experience for future trial design. And one of the aspects which came to the light was that the clear communication of the sponsor and of the contract research organization to the patients is very important. And we think that the patient organizations such as AFM, but also Myotubular Trust, for example, and the MTM-CNM Family Connection in the United States play a crucial role in informing patients about future trials. AFM has played a very important role in recent discoveries for new treatments for patients with rare inherited myopathies. And I think that was vividly shown by the video presented by the president of AFM during the opening ceremony of the conference yesterday. AFM is a major funding body within Europe for neuromuscular research, and each year a very big amount of research projects are being funded, many of which results are being presented during the conference here. Myology Congress offers a unique opportunity to preclinical and clinical researchers from France, but more and more from all over Europe and from other continents to discuss the most recent steps in research which has been performed, and to network and to get together and make plans for future research. And I think during the years we had the COVID pandemic, there were no conferences or only online, and people have really missed the collaboration, the networking, and it's very nice that we're able to do that again. And I'm surprised to see how many international participants there are in this conference, which I always consider to be very French oriented, and it's made a nice next step, I think.